trial, you have to be mentally competent to participate in your defense. But the number of Texans waiting in jail for a state hospital bed to get restoration treatment continues to climb. We continue to investigate this health crisis as leaders grapple with solutions. Take a look. 2 years ago, in March 2020, there were fewer than 1,000 people in jail on the state hospital wait list. A year later, that number was above 1,500, and by the end of last year, it was over 2,000. And now, as of this March, it's hit a new record. More than 2,300 people waiting for treatment, unable to stand trial. Why? The state has blamed the COVID-19 pandemic and a staffing shortage, forcing state hospital beds offline. In March 2020, there were more than 2,200 beds available at sites across the state. Now, 2 years later, that has dropped to just 1,500.
Those are people, and I feel like this is a real, true public health emergency, and it's not being treated like that. I can't imagine, another year just hoping to get increased legislative funding to address 2,400 people sitting in jail for almost over a year. If I look at the average length of stay, I mean, that's horrifying to me.
Hopefully we will be able to have some data-driven recommendations for policy actions or legislative action that we can give to the full JCAFS committee before the end of the summer. So that's kind of our goal.
The state committee overseeing the list recently met to discuss timelines for intervention ahead of the 2023 legislative session, along with new data collection initiatives following our reporting. They are now looking at numbers county by county to determine where solutions are needed most. But despite our questions, they still have not given a timeline to begin tracking the number of people dying on the wait list and whether people were experiencing homelessness or indigence before their arrest. Those are areas experts tell us would help the state target fixes, but the committee says some of that data collection will take direction from lawmakers, which is why we sat back down with Democratic State Senator Sarah Eckhart, a former Travis County judge with leadership experience in this area, someone who has been trying to get more resources, staffing, and funding to tackle the waitlist challenges. At the most recent meeting of the committee that tracks the wait list, the Joint Committee on Access and Forensic Services, one member said she was horrified at the wait list and wait times and at the thought of having to wait another year for legislative action or funding. What can lawmakers do now?
What we can do right now and what the state needs to be doing year-round, every single year, the state needs to keep good data and identify those good programs at the local level where we have some amazing innovation going on and expand those programs, expand them locally and expand them into other locales. It also needs to keep good data to find out what locations are struggling and reach down and help them fix their problems. The state really needs to be that scaffolding, looking for the good programs and expanding them, and then looking for the challenges and helping the locals resolve them as a bridge with the federal government. Most of our funding is local and federally infused.
And for legislation, is there anything you're planning yet ahead of the next legislative session?
I will again push a piece of legislation for a department, an office of forensic mental health within Health and Human Services that's dedicated to this issue, to find what programs are good and expand them, and find what programs are struggling and help fix them. Also, we've got to expand Medicaid. People want to get health care. People want to manage their mental health challenges. And that will keep them from getting into crisis and keep them from being a danger to themselves or others.
As we await the next legislative session, as I mentioned, Texas is working on more recruitment and retention measures to attract and keep staff at state hospitals. That has included in recent months salary bonuses and pay increases. And we just learned job applications were up 40% in March from the previous month, the highest number of applicants since last summer, but it's a long way from full staff. Also in March, the state hospital system had 4,000 fewer workers compared to 2 years ago. One of the other data points that committee's been tracking since we started investigating: race and ethnicity. The state told us January numbers were an anomaly, showing Black people in need of a maximum security state hospital bed were waiting longer than white or Hispanic people for a state hospital bed. But numbers last month show that trend has continued, with Black people spending an average 549 days waiting compared to less than 480 for the other groups. For our full investigation, where we dive deeper into these numbers, go to mentalcompetencyconsequences.com. Concern about bad data has text tag toll road users going months without getting billed, and that's causing problems for drivers.
It is befuddling to me that they couldn't just fix whatever the problem is on the back end and just make this work.
Coming up, our investigation digs deeper into a series of technology problems still plaguing the state agency.